Like, share, and subscribe here on Oncology Tube to get notifications when similar videos are available.
Today I spoke at MOASC, and the focus was on acute lymphoblastic leukemia, or ALL, along with any new updates on immunotherapy in this population. So I presented on 3 separate studies, and I think the general theme was that it acknowledges that the overall survival for adults with ALL has been historically poor, but there have been several attempts to improve this overall survival. And one of the studies I presented was the GMAL study that looked at a population of over 800 patients. It's a German trial that included over 140 sites. And essentially what they did was to look at how patients were historically treated on conventional chemotherapy. And then they also compared them with the second group called Group 2, where conventional chemotherapy was used, but also more of a pediatric backbone, and using asparaginase mainly after induction. And to assess efficacy and response to therapy, they used D, or minimal residual disease, to assess and how well these patients did. And so in that study, what they found was that when you look at the Group 1 and Group 2, the Group 2 fared significantly better in terms of their overall survival, event-free survival. So the median age of this population was about 68, and what they found that the patients who were younger fared much better in comparison to those who were 75 years or older. And they also found that MRD was important, that those who cleared their MRD at the end of the validation phase also had a much more significantly improved overall survival of about 80% at 3 years. And so I think this study, they concluded really that, number 1, using a pediatric-based regimen could be beneficial for adults. Number 2, if asparaginase, which is predominantly used in pediatric protocols, if it's used after induction, these patients did better. They also, I forgot to mention that they saw less cystity in the second group that used this type of regimen compared to the first group. But they also concluded that perhaps moving forward, what they can also think about is using immunotherapy in combination with conventional therapy to further improve overall survival for this de novo group of B-cell ALL, and also hopefully improve their disease that we see with chemo. I also discussed at this meeting 2 other studies. One was using immunotherapy in combination with conventional chemotherapy, and that immunotherapy is called inotuzumab, an anti-CD22 monoclonal antibody. The investigators, this is the GMAL Initial 1 trial, looking at over 40 patients where they use inotuzumab with the conventional chemotherapy. These patients were offered inotuzumab 3 induction blocks. MRD was used at the end of each block, and if the patients had molecular remission, they were then offered conventional chemotherapy thereafter, along with a maintenance therapy. And what they found in this study is that these patients actually had a very good overall survival. What they found at the end of this study was actually all patients, all 40-something patients, had a complete remission, which was amazing. In addition to that, the overall survival at 1 and 2 years respectively was 91 and 81%. So I think that was pretty remarkable. They found that this agent was fairly tolerated with minimal side effects, mainly a little bit of myelosuppression in combination with conventional chemotherapy. So again, using this inotuzumab with conventional therapy with de novo ALL patients was promising. I also reviewed another study where they looked at Ph-positive newly diagnosed patients and combining ponatinib with blinatumomab. This study was also promising. Patients with Ph-positive ALL can have a high incidence of relapse because of resistance to TKIs, and ponatinib is a 3rd generation that has potential to overcome this resistance. And so when they did the study and looked at these patients, they found that the combination of the 2 also showed great promise, and these patients also had overall survival. And so I think that there will be more to come from these studies as these patients will continue with their therapy. So I think the future hope is one thing, is that a couple things, is that when you look at ALL, the population in pediatrics, they have an excellent survival. You're looking at least 90-95%, even some subgroups, low risk, have 98.6. The adults don't fare as well. In the past, you're seeing survival rates of less than 50%. We are seeing much better in the 60s now, even, and then the study that I just mentioned to you in the 80s. But the hope is that by using more targeted immunotherapy therapy that targets CD19, CD22, rather than saving it for the relapse population, perhaps moving it up front to the newly diagnosed and using MRD to stratify the patients that should and could use this, and maybe even using MRD to tailor your therapy and risk stratify these patients. I think that potentially could, number one, improve survival, but decrease the toxicity and really move the pendulum so that these patients have a much better survival than what we're seeing currently. And I think that this field is evolving greatly, and I'm hopeful that we can get the adults and the survival for ALL to improve significantly. I think what I'd like to add is I'd love to see more studies also that focus on, we see that the adults, older adults have a less than optimal overall survival, but it would be wonderful to see also studies also focus in the adolescent young adults with ALL using all these agents up front and also in the relapse setting, because this is another population that doesn't do as well with this disease.
Like, share, and subscribe here on Oncology Tube to get notifications when similar videos are available.